My name is Untitled. You're welcome to my YouTube channel, Nurse Koshola, where I talk about everything healthcare matters, how to age well, nursing career, especially in supporting international nurses and adaptation nurses. So, welcome. If you're just joining, please subscribe to the YouTube channel and share, turn on your notification button so that you can get up-to-date information from here. Today, I'm going to be talking about what I call pain management in older people. As a geriatric nurse and having worked in, with older people for quite a number of years now, as well, I have older parents. We have old people around me. When I say old, not like old, but like aging people, especially from 55 years old. So if you have an older person close to you or that you so much care about, you might want to know much about how they can manage pain. I'm very sure at one point or the other, you've had one older person that is in pain, complaining of pain beside you. For instance, you have an 88-year-old mother that is often complaining of various aches and pains all over the body. What do you think is the safest over-the-counter painkiller for her to take? Are there some that are bad or good, for the liver or for the kidney? So these and some more other information we'll be discussing today. My name is Untitled. Again, if you're just joining, please subscribe. All right, welcome back. Like I said, we're going to be talking about pain management in older adults. If your mother has been complaining or an older person around you has been complaining of pain repeatedly in any part of the body, it is important that you will want to make sure that you get careful evaluation from a doctor. If she doesn't have a doctor, go to any nearby healthcare facility and get her checked if this pain has been, recurrent. All right, just to let you know that frequent aches and pains are a common problem for older adults. Yes, because as we age, our body becomes weaker and weaker. After all, frequent pain can be the sign of an important underlying health problem that needs attention. So don't just think, oh, maybe she walked longer distance or something. I say, it's old age. We need to treat every pain as though it was severe. Just minding that there might be something on the ground, like underlying that as well. So you are also more likely to help your mom or your dad or that older person reduce her pains if you call a doctor, maybe if you call a doctor to help identify the underlying causes of that pain. Like I said, irrespective of the part of the body that's, the pain is coming from. That said, it's a good idea to ask what over-the-counter analgesics are safest for older people, because if somebody is in pain, you don't want to wait till you get to the hospital before sometimes to manage the pain. You just want something to give quicker, maybe even as a prophylactic or something immediate before the person gets to the hospital to check further. That's because improper use of over-the-counter painkillers is actually a major cause of harm to older adults. This is very important. It's a major cause of harm, and we need to take this very serious. So let me tell you what over-the-counter painkillers, generally geriatricians or people that work with older people like myself usually consider the safest, and which very common group of painkillers you should look out for. Now, what's the safest over-the-counter painkiller for an older parent? For most older adults, the safest over-the-counter oral, that is the one you take in through the mouth, the safest oral over-the-counter painkillers for daily or frequent use is the common paracetamol. Some call it acetaminophen. That's the brand name, sometimes Tylenol in some countries. So this is the most frequently used painkiller. No, so provided you are careful to not exceed a total dose of 3,000 milligrams per day. That's some countries will say 4,000, but for older people, we generally want to consider a total of 3,000 milligrams per day as the maximum. That means one of the tablets is usually 500. So you have two, it is 1,000. So if they're taking it 3 times a day, that's 3,000. You don't want to give maximum of that. And if you say 3 times a day, it had to be 8 hours apart. 8 hours apart. So not like you gave it 10 a.m. and then because the person is still in pain, you're giving it at 12 p.m. That is a misuse of painkiller. All right. So paracetamol, also known as acetaminophen, is the most common over-the-counter and is also the most frequently used by older adults. Now, I'm going to tell you a bit about paracetamol and why you need to use it with caution, especially with older adults. It is processed by the liver, and in higher doses, it can cause serious, sometimes even life-threatening liver injury. So if an older person has a history of alcohol abuse or chronic liver disease, then an even lower daily limit will be needed. So that means 3,000 will even be too much for them. So I would strongly advise that you talk to a doctor about what daily limits might be suitable for your older parent or your older relative. As there's a tricky thing with paracetamol, or like you call it acetaminophen, it's that it's actually included in lots of different over-the-counter medications as well. So you find even paracetamol in some other over-the-counter medications. For instance, you find it in what they call the Theraflu, you find it in the Nyquil, in the Percocet, you find it there. So you find it in most of these medications. Tylers, paracetamol is there as well. So people can easily end up taking more daily acetaminophen than they realize, because you're taking 200 from here, you're taking 300 from here, you're taking 1,000 as a whole. So you're having more than you should take. So this can indeed be very dangerous. And research suggests that 40% of paracetamol overdoses cases are accidental. But when taken as recommended doses, paracetamol, which is also acetaminophen, has surprisingly few side effects and rarely harm the older adults. Unlike what they call the non-steroidal anti-inflammatory drug NSAIDs, which I'm going to mention below after now, it does not put older adults at risk of internal bleeding. And it seems to have minimal impact on kidney functions and cardiovascular risk. So it still has its own advantage, only that just make sure that you're taking it within the recommended dose. So be careful or avoid the common classes of painkillers. I'll mention all that. For instance, you get to the drugstore, the chemist, or your pharmacy. The most common alternatives to paracetamol are ibuprofen. Yes, I know you have come across that before. Probably you have it in your house. Ibuprofen, naproxen. They have different brand names, but I'm just talking about the generic names now. Both of these are part of a class of drugs known as non-steroidal anti-inflammatory drugs, NSAIDs, like we call it in medical line. Many people are familiar with these medications, but in fact, older adults should be very careful before using NSAIDs often or regularly. I'm going to tell you why. Unlike paracetamol, which usually doesn't become much riskier as people get older, NSAIDs, like I mentioned, ibuprofen, naproxen, they have side effects that are especially likely to cause harm as people get age. The risks that include increased risk of bleeding in the stomach, small bowel, or colon. So for older people who take daily aspirin or a daily blood thinner, they are at especially high risk. So if your mom or your parents is taking aspirin, you have to be very careful. In fact, it's advisable not to offer them ibuprofen or naproxen. It can also cause problems with stomach lining. I'm talking about the NSAIDs, the non-steroidal anti-inflammatory drugs. So they can also cause problems with stomach lining, which can cause stomach pain or even peptic ulcer disease. So I've had a lot of people tell me that I'm having symptoms of ulcer, and I tell them, what did you use? And they said, because of the pain, I use ibuprofen. That's like adding pepper to an open injury. So because generally NSAIDs causes problem with stomach lining. So, and then if you have used ibuprofen repeatedly over time, you are at risk of having problems with your stomach or even peptic ulcer diseases. So you need to be very careful, much more older adults. NSAIDs also causes decreased kidney function. I'm talking about the non-steroidal anti-inflammatory drugs. So if you buy any medication, if they call it a painkiller, please check the leaflet. Is this a non-steroidal anti-inflammatory drug? It's going to be written on the paper. They cause decreased kidney function. This can be especially problematic for those many older adults who have already experienced a chronic decline in their kidney function. So if you have another adult that maybe they've diagnosed of chronic kidney disease, especially those that have high blood pressure, maybe chronic high blood pressure, there's a likelihood that there will be, some decline in their kidney function. So we have to be very careful when it comes to the use of non-steroidal anti-inflammatory drugs. It also interferes. There's an interference with high blood pressure medications. Yes, this is very important if you don't know. If your older adults, your older parents or relatives are on high blood pressure medications, you need to make sure that you're taking caution with non-steroidal anti-inflammatory drugs, use of ibuprofen or naproxen. Make sure that you consult with your doctor before you use. You have to be extremely careful. So NSAID also has the side effects of fluid retention and increased risk of heart failure. So you need to look at this. So generally, NSAID, older adults should be very careful before using NSAID often or regularly. Otherwise, just consult with your doctor and get the recommended dose, or maybe an alternative. Experts have estimated that NSAID cause 41,000 hospitalizations and 3,300 deaths among older adults every year. Isn't that ridiculous? Like that is enormous to see the effects of NSAIDs on older adults. Also, recent research has also suggested that NSAID causes a small but real increase in risk of cardiovascular event like heart attack or stroke. So because of these well-known side effects of NSAIDs in older adults, the American Geriatric Society recommended that older adults should avoid using NSAID for the treatment of chronic persistent pain. Today, oral NSAIDs remain in what they call the bear list of medications that older adults should avoid or take with caution. All right, that's just a summary of talking about the pain medication or pain management in older adults. Unfortunately, far too many older people are never informed of the risk associated with NSAIDs or even, misuse of pain medications. So sometimes they choose ibuprofen over paracetamol. Remember, like I said, even paracetamol has its risk as well. But every year, NSAID causes far more hospitalization among older adults than paracetamol does. Now, let me quickly talk about aspirin. Aspirin is a special NSAID we no longer use for pain. These aspirin come in different form depending on your country. Vasoprene, you can brand it in any way. So aspirin is another analgesic available over the counter, but it should never be used for pain any longer. Aspirin is no longer used as an analgesic by medical community, but you can still find it over the counter. But many older adults still reach for aspirin to treat their chronic aches or pain because they are used to thinking of it as a painkiller. So aspirin is also included in certain over-the-counter medications such as the Aspirin. So taking a very occasional aspirin for a headache or other pain is not terribly risky for most aging adults, but it has to be prescribed and recommended by your doctor. So I would discourage my older patients or my older parents or relatives from using aspirin for pain. Now, in short, I'm going to be telling you tips on safer use of over-the-counter painkillers for older adults. The safest oral over-the-counter painkillers for older adults is usually paracetamol, provided you don't exceed 3,000 milligrams per day. As well, you need to get the recommended dose from your doctor. So if you have any concerns about liver function or alcohol use, please plan to use the medications daily, depending on what your doctor recommends. So try not to exceed 2,000 milligrams per day and seek medical input as soon as possible. So you should also be sure to bring up any chronic pain with your parents, doctor. So if your doctor, if it gets, just mention to your doctor that your parent has been having a chronic pain in any part of the body, it is important to get help identifying the underlying causes of the pain so that it can be treated appropriately. And don't forget to ask about non-drug treatment for pain. There are so many other non-drug treatments for pain. I'll talk about that in another video. In the meantime, if you're watching, please subscribe to the YouTube channel. Just press the red button there. Now, press it now, all right? And turn on your notification button to have more information and up-to-date videos when I post. So I'll see you some other time. Take care of you. Age well. Bye.